Okay, so quiet breathing then is when you're just breathing and sitting normally. You're not blowing out birthday candles, you're not taking in a deep breath, and during inhalation you just have contraction of the diaphragm and external intercostals, and you get an increased size of your thoracic cavity. So that's what these images are showing you. During exhalation, it's just a passive act. So it's just relaxation of those muscles, the diaphragm and the external intercostals, allowing the lungs to return to the normal size, and air will leave the lungs as the volume decreases. There's something called diaphragmatic or deep breathing. So if you're breathing mainly with your diaphragm, that's called diaphragmatic breathing, and that's in contrast to costal breathing. This is a shallow breathing that you may see in patients when they're unable to move their thoracic cavity by changing and contracting their diaphragm. An example is a pregnant woman. So there's no room for her to pull down on her diaphragm any longer. Oh, sorry, the diaphragm's up here. There's no room for her to pull down on her diaphragm any longer because all of her internal abdominal organs are pressed up into her thoracic cavity, and she has this large baby here. And for that reason, pregnant women are often out of breath. You can also see this in obese individuals, so they'll exhibit this costal or shallow breathing. Now, forced breathing, on the other hand, as I said before, requires additional muscles. These are the muscles that you can use to increase the size of your thoracic cavity and increase the amount of air that you bring in. So sternocleidomastoid, scalene, pectoralis minor, and serratus anterior can all increase the size, along with your external intercostals and diaphragm, which you're using even during quiet breathing. And then finally, muscles that you can use to force breath out forcefully, for example, blowing out a birthday candle, include the transversus thoracis muscle, which you probably haven't learned about, rectus abdominis, and all those other abdominal muscles, and then your internal intercostal muscles.